Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR.
What's
I
going on?
cannot breathe, especially on my left side.
Okay.
Like it plugs up.
Okay. How long has this been going on?
Over a year now.
Over a year.
Yeah.
It's more
probably
on-
more than a year. No, more than a year. My breathing.
Is it more in left or right?
More with the left
Left side.
side.
And you said you had a Bell's palsy?
Yes, I have Bell's palsy.
When did you have it?
I'm say about 15 years.
Okay, I want you to try to smile now. You see the difference between eyebrow left and right? So you see that? He has more expression on the left side. The right side is kind of, is that where you had the...
Yes, on this side.
So can you open your eyes wide? Okay, can you see the asymmetry between left and right? Okay, all right. Can you blow? You see the difference between both eyes? His right eye is closing. So the Bell's palsy, you said, when did you have it?
About 15 years.
15 years. Any headaches?
Just the headaches come with the tension.
And the neck here, from 0 to 10, how much you rate it? 10 is emergency room.
I'm gonna say yesterday was a 10. Today is
10.
a 8.
Okay. And is that constant or it's just like constant pain?
Constant pain.
Okay, what kind of treatment you had for your neck so far? Like you had it
Just
for like a year or 2
just
years? Okay.
Massage.
Okay, massage, what
Yeah,
else?
just massage to get the blood flow, but other than that's it with that.
That's it for, okay. So let me see your range of motion now. We're gonna turn left and right and tell me how, if that increases your pain. Okay, you see how slow he's moving? He's very stiff. He should, like his chin should be closer to his shoulder. The other side, very stiff. You're like almost 45 degrees. It should be like 85 to 90. Can you extend going back? Forward. Where do you feel the stiffness with that?
Sorry.
In the occipital area, both of them?
Sometimes I'm doing this all the time just to feel.
To relax a little bit, okay.
Yeah.
And where do you feel the headache?
And my tightness right here too,
In the neck, okay.
especially my right side.
Okay. All right, so let's actually, we'll have you. Any other symptoms, anything I need to know about your neck? Did you have any trauma or hurt or anything?
I mean, I had a car accident, a bumper, but that's.
You did not hit your head.
Yeah, no,
Okay.
nothing like that.
You feel those bump here? Okay. So he said he feels more in the lateral side on both his neck, occipital area. And that's exactly where I feel the scar tissue, right in those spots. There is more scar tissue. Right in here, you feel those bumps? Okay, is that too much what I'm doing? It's okay. Okay, so it's right in here. Do you have any like issue here in this area? Okay, so you're gonna work on all of this area. How does that feel?
No.
That's too much?
No.
Feel a big scar tissue here. Feel this bump here. Sorry, you see? I know you cannot feel that. Yeah. Too much? That's a very thick scar tissue. Yeah, here, really thick. And that's usually from forward posture. Did you have any accident? Just a poor posture for a long time.
Yeah.
Yeah, we gotta work on you can see it with even my hand here. Okay. So you said this is like clogged up, yeah?
Yeah.
Okay. Is it too much?
No.
Okay, you can put your mask on. Okay. But underneath here, it's very tight. Okay. Is it too much?
No.
Okay. It's really tight fascia here. So your headache more in the occipital area, not in the front, is that correct? Yes, no?
Say again?
Your headache is more in here, or you get sinus headache.
Check it in here?
In here. And you clench your teeth? Yes? Clench your teeth?
Not
or
really,
grind?
but I do feel pain
Mhm.
in this muscle here.
Uh-huh. Okay. Pain in here and here. That's usually either if you clench or grind. You feel it in the masseter and the temporalis. So we'll work on that. I'm gonna show you what to do to avoid that. Feel that bumpy area here?
Mm-hmm.
So he has a scar tissue here in his masseter. I'm sorry, his temporalis. So it's very typical if someone clenching or grinding, he overused this muscle and this muscle, and that what causes tear in this muscle and scar tissue. That's very classic for TMJ issues. A lot of patients, they could be clenching or grinding and not noticing that. Did your dentist tell you you need to wear a night guard or something like that?
No.
Yeah, do you feel it more in the morning, this area and this area?
Yeah.
You feel it more tight in the morning?
Yeah.
So he probably did it at night. Because if you don't clench at night, there's no reason this muscle and this muscle get tight. You know, unless you clench or grind. You feel the scar tissue here?
Mm-hmm.
Keep your eyes closed, okay? You see that scar tissue here? See that? That's make sure you wear sunglasses, especially when you drive, okay? Do
Okay.
you squint a lot?
Yeah.
Okay, and that's what causes like headache in that area and scar tissue in this area. I can see really the thickness of the scar tissue.
I never wear sunglasses.
Oh, you need to. I can see the scar tissue here. Did you see anyone work on a nose like this? Yes, no. They never teach in the school to work on a nose. It's a prohibited area. It's not part of the body. You don't need to work on it. I'm joking. It's part of the body, okay? That's a joke. So it was totally clogged up, or it was just...
I feel the cloggedness more in the evening going to night.
Okay.
Yeah.
What about now, the breathing? Any difference?
Yeah, I can see a little difference.
A little bit?
Yeah, just a little bit.
Okay. Let's turn your head left and right. How's that? Look at that, how far he can go now.
I noticed a little, this angle right here.
Yeah. And the other side. That's a lot more, yeah? Beautiful.
Yeah.
Extend. And can you see the speed of movement? He's moving faster now. So that's a sign of improving range of motion. And look at the bending actually. That's the bending for range of motion forward. Look, his chin is touching his chest. So as I did last time, you know, if it's minor inflammation, I'm gonna use a Magna Heel to try to clear up your inflammation in the sinus. If it's minor inflammation, it should take a few minutes with that. So where do you feel the tightness now?
My
When you
neck.
do the movement in the neck. That's a good. In that area too? Okay. Okay, let's do it again. Okay. You hear the difference? Let's do it one more time. So it's a kind of louder on the right side compared to the left side, and that's usually his nostril is not totally open. How's that?
More relaxed, comfortable.
Yeah. What about here? Extend. Did you feel a difference after the Magna Heel? Just listen up. How is your breathing now? Let's do the sound in both and see. Okay. Any difference?
Just a little bit.
Where do you feel it? It's congested.
This one, like.
Right in that spot.
Yeah, because I even bought some strips like 2 days ago just to hold it up, because I was like, why is it closing now? Like
Okay.
completely.
Okay. So let's lie on your back again. Your neck is fine now, yeah?
I feel the smooth, because I was like about right here.
Yeah.
And now I can feel the
You can go
smooth, like
yeah,
smoother.
it's faster movement. That's a scar tissue here, I feel it. Feel that? Crunchy. Very crunchy in that spot. Keep your eyes closed, okay? Okay. We're not doing no surgery. Not yet, okay? I don't do surgeries. How's that? Sound louder, yeah?
Yeah.
Even the other side sounds stronger now. Is that too much?
It's okay.
Okay. We're not doing Botox, okay? Any difference? After working on it last time?
That's the difference. Still inflammation, but I noticed there's more strength.
So how much improvement now? If you say 100% is back to normal, how much do you get improvement after working on it?
50% easy.
50%.
Yeah.
We still have some work to do because you have a lot of inflammation, and that could be related to your D deficiency and other deficiency. We're gonna work on that. Let's move your neck left and right and tell me how that feels. See how fast he's moving now. Let's extend. Go backward. Okay, and forward. Okay. So how does that feel? The pain, the constant pain that you used to feel?
I feel relaxed right now.
Relaxed. Okay. So what do you think about after treatment? We worked on your sinus, your neck. How does that feel?
No, I'm in the right place.
Yeah.
How easy, yeah. No
Yeah.
doubt.
All right. Awesome. Okay. Thank you so much.